Time now for this week's Health Matters. Paul Critz along with physician assistant Lynn Szabo. And this is one of those like Health Matters. It's really all about like kind of what goes on in the exam. It's not like a specific issue. This is kind of a more meta discussion about kind of attitudes, point of view, what you should have.
One could even say an annoyance I have.
An annoyance? It's specific. Okay, all right. Well, let's get into this then. It is the email that had the topic in today. It's how to think critically about medical information.
Right, because I've been seeing a number of, I kind of an increase if I saw this online, respond to it in some way.
Yeah.
So, in fact, it kind of happens in me at about three levels. One is my own personal use of the internet. So like in between YouTube videos, because I'm thinking moving to northern Italy anyway, like these appalling things about medicine that have nothing to do with reality. And then also patients bring me stuff in that they Google and they want me to respond to it, which is, it's hard to tell them that medicine doesn't really think like that. We'll get to that.
So I just kind of had, and I think I picked this up somewhere, but it was kind of a blanket sort of thing. Just don't ever Google anything. If you have any kind of issue with your own, you're never going to find yourself in a context that's going to be helpful for you when you're all alone and you're Googling your own, because you're
right. And I think the point of it for them is to tell me this thing that I obviously don't know.
Seriously?
Yeah. And
wow.
So some of it is to prove their point, but I think a lot of it is, you were in school a long time ago. You probably missed this lecture.
So so they're assuming that what they heard off the internet, just because they heard it recently off the internet, it's going to trump your professional expertise and training.
Have no idea. I'm not just talking about me. I'm talking about any provider has layers of complexity beyond any of that stuff. And we look at it and go, huh?
Yeah, right.
Yeah.
Because at the very least, I'd come to you in the hopes that you corroborate what I'd Googled, not that I had like the upper hand knowledge-wise. That's silly.
No, I think it's sweet. I think they mean it sweet. Like, oh dear, you were probably sick that day and missed that lecture. Oh, wow. And I'm like, no, because that's not really true.
You don't see that as just unmitigated arrogance and it's perhaps maybe hateful in and of itself?
I try and be nice.
Okay, all right.
Because
that's why.
I have a therapeutic relationship to maintain. So,
there you go.
And then the other cool thing is wanted to have a little aside about this concept called curbsiding in medicine. So me and my colleagues, on all levels, will oftentimes curbside. And what that means is oftentimes a hallway conversation. And you're not really talking about a patient in particular because you can't use names and stuff, but you're talking about a medical situation.
Okay.
And so what do you think about this? Give me a couple ways to understand this. And they will cite papers.
I've got to understand this too. When you're talking in the hallway, when you're curbsiding with another healthcare person, a physician, a PA, whatever,
right.
You can't mention names? HIPAA is tying your tongue in a professional setting like that, really?
In a big way.
Wow.
And sometimes you get one sentence out and you go, let's go in the office and talk about it.
Wow.
So, but it happens a lot during meetings and stuff. Like, for example, we were talking about one individual's chronic low back pain, and they were trying to think of things that they could help this person because it had a radiculopathy component. That means nerves in his spine were causing pain in his legs.
Okay, because I thought radiculopathy was something.
I know, it sounds very Harry Potter.
Yeah.
But I mentioned that I thought vitamin B6 could be good for that because in general vitamin B6 is used for peripheral neuropathies or nerve problems that are on the end of extremities. And then Dr. Castle found a paper on it, and then there was this collegial back and forth about it over a Zoom meeting. So that's an example of a curbside.
In legal play, it's called a sidebar, right? Isn't that the same sort of thing when you kind of step aside and have a parenthetical situation go on?
Yeah, maybe, but I do medicine.
Yeah, I know. That's just an interesting sort of way to...
Yeah.
Curbsiding, that just makes it sound like you're, I don't know. Like
and you always say, hey,
hop.
can I curbside you? And it goes along with an understanding that I'm not going to write this in the chart and
Yeah.
try and hold you accountable if you get me sued.
Right.
You know, it's just like what's your medical understanding
I'm
of
just
this?
spitballing here. Yeah. Okay. All right.
And those are fun. I think I find them actually cool. And right now I have colleagues at Crescent City UHS, and I used to have one actually at Del Norte where we could like geek out on medicine and curbside to our heart's content. So
Medical geeks.
So yeah. So with anything you read on the internet, you need to actively question the source. So when I'm curbsiding somebody and somebody throws something out, and I'm like, "What's the citation?" And then we
Right.
get into InfoWars and stuff. But
I hope InfoWars is never the citation, but okay.
No, it isn't. God no. I would give anybody who's looking for medical information online to not go into it with an assumption that you have an idea of what's right, and what you're really doing is researching support for that. That goes nowhere. Nowhere.
Are you able to communicate that idea to anybody? Because that is just across our entire society and culture. That is endemic.
It is hard for people to hear it, number one, and it's
hard for them to even understand it.
Right, and what they hear you saying is you're not smart enough to truly understand it, which is not what I mean.
No.
I mean all of science, the
What you're saying is that
thought,
you're too dumb to truly understand.
But that's not at all what I'm saying. I said foundational thought in science is that you prove yourself wrong.
Okay, yeah.
You get an idea of what you think might be happening, and then you go about like annihilating the idea.
Right.
And if it still stands, and you can get a useful, action out of it, like a second hypothesis or something like that, then that gives your initial idea strength.
That's just the scientific method that everybody failed
totally.
to have.
But
failed to learn in school.
starting with a certain worldview and then finding information to support it is the opposite of critical thought.
That's what do they call that now? Bias confirmation.
Right. So be aware of your own assumptions because they're oftentimes not right. And then this should also be basic too. Is the source that you're listening to trying to sell you something?
That is becoming more and more difficult as these people who generate this kind of content, and I think they are legitimately evil.
Yes,
because they're trying to trick people. They're trying to trick the person who isn't being careful, and that makes you just a jerk in my mind.
Yeah.
But they're going out of their way. All this stuff it's coming across like, oh no, this is nonfiction instead of it being an ad.
So the minute I see something like that, and it a product shows up for me to buy, I turn it off.
Right, because there it is. There's the reason. Yeah.
They're not necessarily being truthful. They're being salespeople.
You can also get it too if it's somebody that has, like, if it's a website, if it's a source that has legitimate health like information for you that you need to have, they present it right away. Right. If you're having to click through and read on to get down to it, then you're being kept on a page to look at ads, and you're already being sold something, or you are what's for sale.
Agreed.
So you have to. Yeah. That's a difficult thing to do, and I think it should be a course in school these days, how to tell like the veracity of what you're viewing online. How to tell what the purpose is of it. Are they selling you something? Are they trying to inform you? And
it should be really basic, like at high school level, I think.
Yeah, definitely.
Yeah. So anybody selling anything is off button. Beware of people presenting their own personal experience and then drawing global conclusions from it.
And that's also tricky because much of journalism has kind of focused on that man in the street sort of thing to make it more approachable to the audience so that they can ensure more audience, so that they can sell more ad space. Right. It's all money, and it's all vitiated and shot through and ruined. But
sickening.
People just across the board, it's not even like that's not even a ploy to slip one by you. that's just how people write these things. Have you watched network news at all recently? Any network news?
No, I blacked out after the election. I was so pissed.
Yeah, well, you can go back several decades, perhaps, and see this develop in time as each report spends more time talking to me about some random yokel on the street telling me what they think. I don't care about that. Tell me what the experts think. Tell me what's going to happen.
Exactly.
Give me journalism. Don't give me point of view.
Legitimate experts, because oftentimes people will look expert-oid, you know, middle-aged white male, slightly graying hair.
Yeah, that's all you need.
You know, yeah, it looks just like you.
We decided at the meeting, I'm an expert.
Yeah.
No, exactly. And that there are people out there who are trying to present themselves as being experts because they have an agenda, they have a point, they want to sell you something, and it's just
completely
lying to you.
And I would say, as a little bit aside, if anybody identifies themselves as Dr. John Smith, MD, medical professionals see that and start saying quack, quack, quack.
Is that redundant?
You do. That is, oh, God,
Is
it's
that just
cringeable.
stupid? Really?
It's cringeable.
Really?
And, yeah, nobody needs to put that up there twice. And most physicians who don't call themselves doctors, they call themselves physicians, go with the John Smith, MD, and they don't need to have the doctor in front of it.
Okay.
Because, quite frankly, doctor can be a little bit hard to understand what that means. So doctor of podiatry,
Right.
doctor of chiropractor, doctor in English literature.
Anybody with a
doctorate.
PhD. Yeah, exactly.
Yeah.
Right.
Yeah, so they go with their MD.
Okay, good.
Whereas
That's a very helpful tip right there. Yeah.
So
okay.
anybody that says Dr. John Smith, MD, is like, out the window. Okay. So you have to consider the age of the information. Interesting anecdote on a curb. That wasn't really a curbside, but a point of discussion during a provider meeting at UHS. The Infectious Disease Society of America put out a position paper in 2010 about how to treat urinary tract infections in young women of reproductive age that are straightforward and without risk. Okay. And one of the providers who wasn't aware of this, this is a seminal paper. This is arrived at truth. This is golden, has not been changed, except not really recognized in Del Norte. So we're bringing it to Del Norte. And one doctor said, but that's 2010. That's like ancient information. Because she thought it was just a regular paper and not a position paper.
Right. Yeah.
Yeah. So consider the age of the information in medicine. When we're talking our language and down to the nitty gritty, anything over 3 years is like, nah, just shaky.
Yeah.
Has anything disproved that, or has that gone on to predict something that turned out to be true and increase the?
So how can you tell if something is like this one report and it's foundational like that? How can you tell?
Well, I think if they don't. Oh, how can you tell?
How can you tell?
Because it was really clearly identified as a positional.
Oh,
paper.
okay.
The Infectious Disease Society of America, she just wasn't particularly aware of it, I think.
Okay, gotcha.
She's a great doctor, one of the best. But, her PA is buzzing around her going, we could do this. And the Infectious Disease Society says to do this, and it just didn't hit her radar.
Oh, wow, okay.
So, I would also get information from credible medical sources. And my go-to is the Mayo Clinic, actually, because the Mayo Clinic, more than any tertiary care group of medical entities, was started with what we hope are the best intentions in a physician's mind and energy and excitement. And it's, I don't know what it's evolved into. It's probably, approaching 200 years old now or 180 years old. But I trust that historical foundation. So I go there a lot. American Cancer Society, American Heart Association. So don't go to Billy Bob's theory of the universe, because that's not likely
to
be where you're going to get the best information, and that should be really easy to sort out.
How?
You either see that information there that reassures you,
But no, so how do you tell if it's reassuring information? Here's what I'm
because it's an entity that should be relatively known in the field as providing good care and good information. So how do you know?
Yeah.
I would Google their name and see what's going on with them. Are they there to sell vinegar for toenail fungus, or are they there to help people?
I got one for you.
Yeah.
I find some health stuff every once in a while, like an NIH. Right?
I like the NIH.
How political is that? How politically influenced is that?
Well, pretty soon it's going to be a non-entity.
Right, it won't be around anymore.
Yeah.
Moot point.
Yeah.
CDC, same thing, right?
Yeah.
Yeah, great.
Yeah. Yeah, I can hardly wait till I see measles in Delmore.
Yeah, hey, that'll be fun.
You mean, you could have asked that question during the COVID epidemic, I think. And a lot of people brought it up as, as they were politically influenced. But they had the data. You could go into a data war with them.
That's true. Yeah, the NIH is right out there when you see things online. They've got like this,
Right.
here's what we're basing this on.
Right. They don't hide their references.
What about WebMD?
Yeah, I will look at it if I can find something better. But it's kind of
It's like a
it's kind of like
Wikipedia.
what you've
Yeah.
said about Wikipedia.
Right,
You could
right.
start there,
It's a
but
good
don't
start.
hang your hat on it.
Right. No, that's absolutely true. Okay.
Yeah.
Okay.
And then the other thing is try and be aware of the opposite view and to find reasons to support that.
How do you mean? Like, well, you're working the scientific method again here, aren't you?
Right, totally.
Yeah.
Yeah, so try and at least think of reasons why what your chosen truth, in air quotes, it could be wrong.
Yeah.
And see, you look at it kind of in the reverse.
I don't know. It seems like all the things you're saying could be not even medical, not even healthcare. This is just getting information off the internet anyway. This is why this should be a class in school.
Yeah, just totally. And maybe the internet is not necessarily, or like YouTube, for example, the parts of the internet are not the place to go to get information.
Right.
You can go into Google Scholar.
Ooh, Google Scholar. I don't know anything about Google Scholar.
Hence my point.
Uh-huh.
Okay, so you could go into Google Scholar. It has its pluses and minuses. But if you Google Scholar, you will get a bunch of scientific papers and position papers and presentations at meetings and stuff. Not TED Talks, but at scientific meetings. Now, the first thing you'll notice about it once you get your topic window down is that, those data are like oftentimes 10 or 14 years old.
Right.
So there's that problem. But you could kind of use it to look at the development of an idea if you wanted to. So, and if you're a high school student and you're not using AI to write your papers, Google Scholar is a reasonable place to start for scientific information. For example, I think picking up dog poop is not necessarily going to be helpful. And I wanted to know if dog poop was inherently disease-provoking or whether it's just gross. Okay. It's totally gross. I get that. But so I had looked for papers on Google Scholar to compare the pathogens in dog poop with the pathogens in horse poop.
Uh-huh.
Horse poop is a problem.
Really?
Nobody picks up horse
No.
poop. Of course, you could argue there isn't as much. But
not where I go.
Yeah?
But yeah.
Yeah, well, it gave me the realization that it's not so much disease-provoking like Grandma told you. It's just gross.
It's
and
just
nobody
gross.
wants to step in it. And from that point of view, I was at peace.
Okay, all right, yeah.
But so that's how I use Google Scholar about that level.
Okay.
To answer those important life questions. Anyway.
Well, that's very good to know, actually. That's it. I go walking a lot of times on a horse trail, so I come in contact with horse poop all the time.
Yeah, horse poop is a
My
big
dog
Giardia.
runs through
It's a
it.
Giardia vector.
Really?
I
Okay.
know, and Giardia is a human pathogen.
Okay, I gotta watch that. Jinxie runs through the horse poop all the time. It's
Right,
all over
and
the
it's
horse
got
trail.
all
yeah.
kinds of wormy kind of things in
Ew.
it and stuff like that. But it's not disgusting if you happen to stumble through it. You just kind of keep walking.
Right.
Because horses are vegetarians. They don't eat meat. They don't have to get rid of the sulfur.
Yeah.
And it doesn't stink and it's not adherent. So anyway, if you find something that you're hoping is truthful or is going to help you, run it by your provider. Okay. And don't put it in your provider's face as truth, because your provider understands medicine at and they're supposed to understand
that's
medicine.
why you're there with them.
Yeah, at levels of competency that it would, I guess, surprise people.
Unfortunately.
But maybe your truism that you found online is true, except that it's not going to apply to you because you have a certain circumstance. Or maybe that truism you found isn't going to apply to you because you're already on a medicine that couldn't be mixed with what they're suggesting herbally. Or it could up a risk factor for another problem. So it's not only the central, I guess, area of information, but there's ancillary considerations that people don't really consider, but providers are taught to look for.
That's what you have to do. That's why you go and you get your degrees and you learn all the things you do. Exactly.
And that's why in the exam room, I oftentimes whip out my phone and check my Hippocrates, and I can get things about drug interactions or like, is there really evidence to suggest that turmeric helps with osteoarthritis? There's moderate evidence. It's not great, but it does other things that aren't good. And your provider can guide you through that. So don't assume you have some fact that we weren't aware of. That's kind of cute.
Cutting edge. I'm out in the parking lot.
I don't
on my
laugh
phone.
at people. Yeah, I don't scorn people if they, in their enthusiasm for good health, that they want to tell me something. I don't snicker. But I might point out why that's a terrible idea.
That's got to be really frustrating, though. But I think it's frustrating.
Not.
Really?
It's not.
Why not?
Because you have to maintain a therapeutic relationship with somebody where they are, and you don't necessarily have to emphasize some weird hierarchy that's not helpful. And not always there even. There's no. Then not just because I went to PA school and I practiced a long time, I'm not inherently better a person. So I might have access to information they don't have. I know you're smiling like I've met doctors like that.
No. I'm smiling, going, well, that's why I'm not a doctor.
Yeah, you don't like gross stuff.
I don't mind the gross stuff. I don't like people. It's and stupid people.
Well, then you could totally
me.
be a pathologist. You guys and those are the kind of people who go into surgery.
Is that like the analogous, like to the boys in the lab in the crime shows? It's
completely.
The pathologist.
They're like just too geeky for regular.
I can't interact.
The regular interaction. So.
Oh man.
Yeah.
This just seems like this is if we could do what you've outlined here for folks in the bringing information that they think they're sharing here with healthcare providers in the exam room, if we could take this sort of rubric and just apply it and let everybody live this on the internet, I think we'd be in a far better place as a nation.
Everything. Yeah.
Critical thinking. You're just teaching critical thinking.
And this should keep nobody from asking a question about information they've come across.
No, not at all.
You have the right. That's actually what I am, is kind of a hired information person that happens to be able to prescribe, or order tests, I suppose.
Right.
You should get your questions answered in a really respectful way, and I think most providers know that. So, and the other thing I don't think people are cognizant of is that medical thought changes rapidly. One of the branches in our medical library is actually called Up to Date. Oh, wow. And the cool thing about it is, we always look at the dates when, when was this written? When are these data from? And they put it right under the title, like on top of the author list, revised. And oftentimes that's within the last 2 weeks.
Wow.
Or maybe the last 3 months. And so, there's nothing like fresh data or a fresh way of looking at something. Yeah. So these are all things that we look for that are super important. So what you're looking at might not be up to date. Look at multiple sources. So I've just mentioned there's 2 wings in my medical library, Hippocrates and Up to Date. And there are other ones too that I could look up if I needed to. And there's actually some books. We still look at books.
Oh, wow.
Yeah. because that's where all the cool derm pictures are.
That's a thing for you, I know.
Oh, completely. But if you want to go for the best analysis, you have to be willing to look at the actual studies. And this was kind of something we learned in COVID, is you have to look at the actual studies, because there was a lot of bad data going on out there, and you have to look what's the group of people that were studied.
I think that's assuming a whole bunch of ordinary people to look at it. Because if you've ever looked at an actual study, first off, it's dense AF.
Your eyes glaze over.
And you've got to, and you've got to look at the methodology, and then understand the problems with the methodology, because that's going to determine problems with your outcomes. And it's just it's a whole other subset of specific knowledge you should have, is how to think about it and approach
statistics, how to look at p-intervals and stuff. I'm not really advocating for that. But if you're looking at something that this question was answered with 15 people's experience, you already know that's pointless.
Exactly.
You can look at the N, which is the number of people that were involved in the study. So it doesn't have to go further than that. Oftentimes it doesn't, because really they only have 35 people.
I really enjoy like the meta studies, the studies that are super high level things and that go on for years and aggregate a bunch of different information and stuff like that.
But you also have to be careful with those that they're comparing the same things,
right? Because you're
not
inputs.
Controlling for all the exact same variables in that, and so you get a little out in the weeds sometimes.
You can kind of be out like cherry picking, I guess, if you've got just an inordinate amount of information to try. Yeah.
And you have to realize that statistically, if you have like you make a difference in 5 people out of 500, does that make a difference to you? Is
you're one of the 5.
The chances are you're not one of the 5.
Yeah, that's true.
So look for numbers like numbers needed, numbers of people that were treated in order to have a positive effect.
Okay.
That's a really important one. So if you have a statistically significant value, but you have to, that might mean treating or having a successful outcome for 3 people as opposed to the other 50. Are you feeling lucky today?
Yeah,
that might not be a strong enough association for you to jump all over. So, and if it doesn't hurt you, then.
And it's also, is there some difficulty in the fact that it seems like a lot of like studies and things like this, papers that you can read they're not pointed so much like you have, like, here's what you should do. Why the person reading this? It's just more observational and drawing a bunch of holes.
Like if you have 50 people and half of them we treat this way, half of them we treat that way. This seemed to help, but not getting it. Or my favorite, the placebo works better than the treatment, because that's a thing. So
it's nuts.
So it's not. Your point is well taken. This takes time. A little bit of education is not a soundbite conclusion, but your provider knows how to understand all that stuff, and if you bring it in, they could probably address it. But if you've glazed over already, and that's not the way you best get your information, they can still help you.
Yeah.
So
okay.
Yeah, and then This is harder. This is more intellectually difficult than you would think.
Yeah. You've got to. The whole way you interact with information, you've got to, and you have to start by seeing and realizing the things that aren't readily visible to you. Your own biases, your own preconceived notions.
And if your provider lights up and geeks out, that's a good provider.
They're engaged.
If your provider is, I don't read that stuff.
So if you're going to see Lynn, make sure you've got something fun on your skin to show her.
That's right. Pus is my life.
Just sit right up.
Yeah. So.
Well, that was very informative and can be applied to in so many different ways.
So many different directions. So hoping to have the pool people talk to us next week. As we pointed out, they've been busy. I'm kind of like giving them pause. And I am trying to talk to Del Norte Community Health Center to talk about changes at the teen clinic, which are super exciting. So,
all right. Well, we look forward to hearing about all of that stuff on the very next Health Matters. Thank you very much, Lynn.
Yeah.